Well, welcome everybody. We're so glad that you're here, that you'll be with us for the next little bit. As other people are joining us, we invite you to rename yourself. We always love seeing who's here and where you are, which will come in handy as we're answering questions later on in the presentation. So we'd love to know your name. My name is Lori, and I'm going to write it that I am in Calgary and give you all a chance to do the same. And as more people are stepping into this space, I'm going to share with you in the chat a link to our Instagram account. We share lots of helpful information, upcoming events, lots of different things on there. And so if you're not already following us, we'd love to have you on there as well. Great, love to see some familiar faces. It's very exciting. Well, today we are talking about how to integrate psychedelic assisted therapy, or PAT, into your practice using the co-care model. Joining me today is Jack Lovely. You can say hi. He's the VP of Western Operations and is currently in Edmonton. Suman Brar. She leads our strategic planning and outreach at ATMA CENA, and Lisa Kemp, Director of Programs, also in Edmonton. And they're here to answer some of the most common questions that a lot of people are wondering about in regard to how to actually use psychedelic assisted therapy in your practice. So welcome all of you and welcome to our panelists. So happy that we get to do this. Jacques, let's start with you.
Sure.
So can you speak a little bit as to why psychedelic assisted therapy is becoming such an important part of mental health care?
Sure, absolutely. Well, I'm sure many of the therapists that are here are experiencing this as well, but many clients have tried talk therapy, medications, years of treatment, and for many, they're still struggling. So ketamine-assisted therapy is showing great promise, not just for depression or PTSD, but also for conditions like chronic pain or grief or addiction, in particular at end of life or end of life distress. So what's becoming clear is that psychedelics combined with therapy, the benefits seem to last longer. The intervention seems to go deeper, and the healing be much deeper. And we know sort of overall that the client complexity is diverse and really that there's a need for a tool that can help them in that sort of complex resistant scenario. And in particular, when it's complex and diverse, it's great when they're able to work in an integrated team as the approach.
Great. I'm hearing that as well. Thank you. So when we know that psychedelics are proven to help a variety of mental health conditions or presenting concerns, but there's something getting in the way for therapists to start adopting it. Can you address that for us?
Yeah, you bet, Lori. So basically, we know that a lot of mental health practitioners are interested in this space, and a lot of them are actually even pursuing training with these modalities. The issue comes like after you get training, right? Like you have all of the tools now, you have the knowledge, but you don't actually have the infrastructure to be able to implement psychedelic assisted therapy into your practice. So what do I mean by infrastructure? So the first thing is they don't really have access to clinics that have the operational setup to offer these medicines. Second, they don't have access to the medical oversight that's required for PAT. And lastly, navigating the regulatory piece can be quite complex. So for most therapists, like you can imagine, this would be pretty hard to navigate, especially when you're dealing with a full caseload. So that's exactly what co-care is here to solve. Like we are trying to bridge the gap that exists between being able to take the training and actually implement it into real world practice.
Yeah. Yeah, and speaking of co-care, can you give us a high-level overview of what the co-care model is?
Yeah, you bet. So co-care is essentially a collaborative care model that is meant to empower mental health professionals to offer psychedelic assisted therapy in a way that is safe and ethical without having to worry about those hurdles that we just discussed. So a therapist or wellness practitioner doesn't have to worry about building out a clinic or changing their existing practice to, deal with all of the operational requirements that exist with PAT. They also don't have to worry about arranging for medical oversight or navigating the regulations on their own. They're really plugging into ATMA CENA's infrastructure as well as our integrated interdisciplinary team. And we're really able to help on a lot of fronts. So we take care of the medical screening, we help with readiness assessments, we help with client education associated with PAT, and then we help with the medical delivery of the medicine. So what that essentially allows wellness practitioners to do is they can focus on what they do best. So they're staying in the therapeutic relationship with their client, and they're able to help with areas according to their credentials. Of course, they're able to help with preparation therapy. They may be able to sit in a medicine session. They may help with integration therapy. It really depends on their education, and we'll help them navigate that space. But the goal of co-care is essentially twofold. The first is we want to ensure safe access to these medicines, and we want to do so in a way that really allows for continuity of care with their clients.
Yeah, great. And I talk to therapists all the time, and one of the things that they wonder most about is how to get involved or what levels of involvement that they can have in the co-care. And so, Jacques, I wonder if you can take us through what involvement means and what the tiers of involvement in co-care are.
Yeah, absolutely. So I think the best way to start an answer to that question is to really just start with the clients. So what we recognize is that clients seeking psychedelic assisted therapy in a regulated context are often medically and mentally complex. So as such, they require a higher level of training, experience, credentialing to support. We're very aware that the psychedelic industry already exists. It's existed for a long time, and it will continue to exist. However, now we are bringing it into a regulated and credentialized environment, and we'll be able to continue to help it evolve to be more accessible for clients and to be more inclusive for providers. So in Alberta, where regulation and accreditation first emerged, our practice took shape with sort of three tiers aligned with specification within the regulation. So that first tier, we'll just call it tier two, and work our way through down to down the pyramid sort of thing. So in tier two, you participate fully in the care of the client. So you're able, based on your designation as specified in the regulations, you're able to provide preparation and integration therapy in a psychedelic session, and potentially from your own practice. Like you could do that even from your own practice. You can attend medicine sessions as a compassionate witness, and we can talk a little bit more about what that means. You can deliver active therapy during a psycholytic session held within the clinic. We can talk about the difference between psychedelic and psycholytic. And you can deliver active therapy in an SAP application or a special access program application where we're delivering psilocybin for major depressive disorder or for end of life or existential crisis, or MDMA for post-traumatic stress disorder. So based on those regulations, this group includes regulated therapists such as registered psychologists or registered clinical social workers who want to be fully involved in their client's psychedelic assisted therapy experience. I'll move from there to tier one. So in tier one, you participate. You can provide preparation and integration for your clients within your own practice. You can attend medicine sessions as a compassionate witness, so you see that similarity. And in this example, it would be a good fit for people who are certified counseling professionals, so those who are certified by the Canadian Certified Counselors the Canadian Certified Counselors from the Canadian Counseling and Psychotherapy Association, or registered professional counselors from the Canadian Professional Counselors Association. I know those names are very similar. It took me a while to straighten that out, my own mind, but who want to support clients and to be involved in their psychedelic experience. And then in our third category, that's where we're inclusive of those wellness partners. So these are non-psychotherapy professionals. So consider their maybe yoga teachers, their body work instructors, massage therapists, others who have wellness designations. They're aware of people who would benefit from the intervention, but they don't necessarily participate in psychotherapy. But they do play a vital role by referring their clients and by supporting them potentially as a compassionate witness and offering other adjunct services within their scopes of practice.
I love it. It feels like there's a space for everybody who's been called in by the medicine. I love hearing that. Thank you. So just to make things just a little more clear, could you give us an example of someone who would fit into the tier one?
So say you're a certified Canadian counselor, so a CCC, that's the designation that they go by. In that case, you would manage the preparation and integration, so that initial therapy that supports their intention and their mindset before they would come into the clinic to go through their medicine session, and you would potentially support their integration or that therapy that happens 24 to 72 hours after the medicine. You could do that in your office or online as a part of your practice. And then when your client would visit the clinic where they'd have the medicine or where we would administer the medicine as a part of our practice, and then you could attend that medicine session in that scenario also as a compassionate witness. And so we've created that role for people to be able to be present and to offer support alongside their clients while they're in medicine. So you conduct that integration afterward, and as I said, that sort of happens within the 24 to 72 hours.
You know, as one of the comments that I receive from therapists is that they are excited that they don't have to necessarily be working within a ketamine clinic or be part of a ketamine clinic. They can just sort of collaborate with us and keep their practice uninterrupted. That's some of the feedback I received, so that's very exciting. And there's a bit of a difference with tier two. So could you walk us through what that means?
So remember that sort of tier two designation and some of that separation in therapists happened in the Alberta context, where regulation was really specific about who could participate. But now let's use a Toronto example. So say that you are a psychotherapist in Toronto and you want to offer low-dose psycholytic therapy sessions. And so you and your client would visit our clinic in, say, London or Vaughan for the medicine administration, where you would, the nurse would administer the medicine, but then you as the therapist would conduct the active talk therapy for the 2 hours with the client that is catalyzed by the medicine. And then depending on the client's treatment pattern, they may want additional integration or therapy to support that session. And so again, you would try and do that in the 24 to 72 hours.
Thanks. And then there's a special space for wellness practitioners. Can you tell us about that?
So we'll use an example of, say, a somatic healing practitioner in Calgary. And so you have a client that you know would benefit from psychedelic assisted therapy. You refer them to us for treatment, and you support their journey by potentially coming in and being a compassionate witness during that medicine session. It's optional. You don't have to do it in that scenario, but you are welcome to. And then afterward, so after their specialty treatment is done, then you would offer your complementary or holistic modalities to support their continued integration or adaptation of the experience they had into their life.
Beautiful, thanks. So speaking of clients or participants or patients, depends on where you work, how you call people that come to you. Let's just switch gears for a minute to Lisa. What does treatment look like from the eyes of a client or participant?
Sure. Yeah. Well, our team, if you have somebody that you want to refer or somebody that you think would benefit, they can start with like a complimentary information call. So we have a client support specialist that'll just kind of go over sort of how the treatment is set up and screen for contraindications that are absolute, just to make sure the client is safe to proceed and they understand how our program is set up. And so we handle all that. And from there, if a client chooses to proceed, then they would meet with one of our prescribers. So these are clinicians that are either general practitioners or nurse practitioners, depending on the province and the circumstances. And they would do a full intake assessment that we call a discovery call. And from there, once a client is approved for treatment, our team also supports all the orientation components. So, managing expectations, preparing them for what to expect, a tour of the space, also providing materials so that they know what medications to hold and which ones to take and all of that sort of stuff. So there's lots of education, preparation, managing of expectations. They'll know how to look after themselves afterwards, how to manage side effects, all of that. And so we do that all up front in the intake process.
Great. And what is a client's typical experience during a medicine session?
Well, at ATMA CENA, we have a kind of a team pairing in a psychedelic, for instance, a psychedelic ketamine session, which would be a nurse and a compassionate witness. And so a client, again, has been prepared. They have seen their therapist for their intention setting, and then come to us in the clinic, and we support them with, we do a pre-medical assessment, administer the medication, monitor the client, hold safe, energetic space, help them with a debrief afterwards, and just to kind of, unpack, encourage them to use their journal and make sure they're safely discharged. We also have a nurse that follows up with clients the following day of their first experience, just to see how things sat with them, get a sense of dosing, do they need help with side effects. And we also have someone on call available if that's required. And of course, as a part of their orientation, they're always given aftercare instructions as well. So that's what we would do. And in that session also is that compassionate witness, that, continuous abiding presence and energetically, holding safe space for the client. And that, if you choose, can be you. And if so, we would provide an orientation and make sure that you're comfortable in the space so that you could do that.
Great, thank you. And that psycholytic session is a little bit different than psychedelic. Can you tell us a little bit about that?
Sure. Yeah, psycholytic session is really an active therapy session where we use, more of a relational dose to help to catalyze the therapy session, help clients connect their mind, body, spirit, if you will, and get in their window of tolerance when we're doing deeper work. So how that's done in our team is our nurse supports the dosing. They determine the dosing and provide that first initial dose. We sort of wait to see, to get to that desired effect. And if required, we'll give a boosting dose. And once we've done that, we actually leave the session. I say we, I'm a nurse as well. And then we would, the nurse would exit the session while the therapist continues in that treatment. So for anybody in our tier 2 in Alberta, for instance, you would come into the clinic with your client or meet your client there, and we would do that session with you in partnership. And then the nurse always comes back, to just do an assessment and make sure they're discharged safely. Go from there.
Yeah. Thanks. One of the questions that I get all the time that I'm not great at answering, so I'm so glad that you're here, is about billing and how that works when you are sort of working in different spaces. So Lisa, I wonder if you can tell us about that.
Yeah, sure. We designed the program so that the client is really paying for their medicine session and our teamwork there. And you would maintain your therapeutic relationship and your billing relationship with your client for the therapy that is supporting the medicine.
That's very clear. Thank you so much.
Yeah.
Nojat, I know that one of our big dreams and visions at ATMA CENA is to really expand access to psychedelics, not just to clients, but practitioners as well. So I wonder if you can tell us about the locations where co-care is available and what is sort of coming up for the next year and a bit.
Yeah, absolutely. I guess I would start with our corporate clinics. So I think lots of people are aware that we have four sort of ATMA CENA locations, and they're in Calgary and Edmonton, and in Ontario, in London and Vaughan. And then some of you may be aware, but maybe not all of you, that we've been really working to help support access across the country by supporting therapy clinic owners who want to add this service line as member clinics. And so that means that we work with them to work through what they need to do within that organization to build out the service to the level of what would be expected in regulation and credentialing. And so we work through that process with them. And at this point, we have four member clinics that are already open or opening soon. They're in Sarnia, Milton, Mississauga, Port Credit, Mississauga, and Ottawa. And then we have three more that are sort of in various stages of sort of applying for the process or in process. And they're in Windsor, Waterloo, and Fort McMurray. So we're rapidly expanding and always open to exploring new locations. So I guess for those of you who are here, if you're aware of clinics that are interested in offering psychedelic assisted therapy as part of their service and they'd be interested in working with us, then please reach out.
And we'll share our contact details in a little bit. But Suman, practitioners also want to know what are their requirements for training to be part of this co-care program. Can you tell us about that?
Yeah, for sure. So, psychedelic assisted therapy training is definitely a prerequisite for co-care. We've created an awesome course package that we call the co-care bundle. And essentially, it gives you everything you need to offer PAT safely. The first is the intro program, and then we also have the advanced course, as well as the ketamine assisted therapy clinical foundations course. By pairing them all together, you get a little bit of a sweetener. I think it's about a $600 discount when you purchase the bundle. We're also open to training from other institutions, but it just has to meet our equivalency standards.
Great. Lisa, and I know you're quite involved in some of the experiential or in-person training aspects of ATMA CENA. So can you tell us some of the new news and some of the things that we've been doing for some time now?
Yeah, I'll start out by saying, we have a lot of different options for experiential learning, and one of them being, a compassionate witness in our clinic, and another one actually that I wanted to sort of sneak in here today. We have facilitators that we coach and train for facilitating integration circles for clients that are almost, completing their care or aftercare and want that ongoing sense of community and support. So that's another way that we welcome people with various different skill sets to come into our team and work with us. In terms of training, yeah, we've been working on something for quite a while. We're pretty excited about. So we do offer ketamine training, and as many of you might know, but we've now added a component that for those who choose to continue in their experiential learning can join a group cohort and would be assessed and approved and receive a psycholytic and psychedelic dosing and have opportunity to learn how to hold space and support intention setting and integration and that real hands-on work. And additionally to as an extension to our advanced course, we have in-person coaching. So it's a wonderful course. You would come in and get to know a cohort of other people working in the field in all kinds of different areas. The diversity is always really beautiful. I enjoy very much teaching in these sessions, and so it's really hands-on about looking after yourself and experiencing a non-ordinary state of consciousness through breath work and getting a little taste of somatic experiencing, learning about, therapeutic relationships, indigenous culture, and different components of working with them, and then some real hands-on pieces, like a lot of how would you approach different case scenarios in an integrated interprofessional approach when you're working in various settings. So we go through a lot of different scenarios that way. And yeah, just talk about how to support your client with their felt experience, nesting, grounding, lots of just hands-on stuff that we do with one another. Like we say in our field, like what do you do in what do you do for yourself in this role? And I'm like, whatever we do as a compassionate witness for the client is what we do for ourselves and each other. And so this training is really to kind of capture all of that in one weekend so that you are ensuring you're looking after yourself and knowing who to reach out to when you feel like you don't have all the answers for your client, because it does take a village and you shouldn't feel like you're in a hut outside of that village. And that's what we really hope the co-care program especially supports for your practice. So.
Definitely. And I may be biased because I'm very involved in those weekends, but it's my favorite part of the training. As things come out and develop and are launched, all of that information will be found in our newsletter. That's at atmacena.com, but I'll put it here in the chat as well. If you haven't signed up for that, that is the latest and greatest information that comes out once a month. And then that is our training email as well. If you're wondering about some of these pieces that are already available, we'd love to have a chat with you about that. You know what? We didn't really go into SAP, Lisa, so I wonder if we can talk about co-care and SAP, special access.
Sure. Yes, SAPs. So as many of you know, it's special access program through the Health Canada program to give access to those who are suffering from complex PTSD and qualify for MDMA, and those who are struggling with existential crisis with terminal illness or treatment-resistant depression can have access to psilocybin. And so we would do the same intake process and screening, and they would be approved by a prescriber for that. We would then pull together the application for Health Canada, which is, pulling together all of the history and current medical status and everything that goes along with it. And we would submit that to Health Canada, speak with them back and forth, advocate for your client. And then once they're approved, we would connect back with you, and you would be a part of the client's sessions, depending on the levels of participation that you want to do, and also depending on the medicine. Typically, MDMA is two therapists, and psilocybin is often a therapist and a nurse, and those vary from time to time depending on the client needs. So we want to meet the client where they're at and walk with them where they're going, and then do that with you in partnership. So there's no real cut and dried formula for that, although we use evidence-based approaches to how we support people with MDMA and psilocybin in our clinic.
Beautifully said. Thank you. Okay, Suman, so let's say someone is ready to join co-care. What is the process like?
Yeah, so we have a pretty streamlined process. So first we start with a inquiry call, and we just check to see if co-care is a good fit for you. And we're also going to discuss training as well. So if you don't have training, we will direct you to our education coordinator, yourself, Lori, who can help guide them to the right courses that fit their goals. And if they do have education, then they can sign up for the co-care program. Once they sign up, we'll do an interview orientation with them. And essentially, we're going to determine which tier they would best fit into. So that would be either tier 1, tier 2, or our wellness partner. And we'll also provide a comprehensive guide that's going to detail documents that you'll have to gather, agreements that you'll sign, as well as marketing guidelines to help you promote psychedelic therapy services in your service line. And once all of those documents are gathered and agreements are signed and you have a client ready to start psychedelic assisted therapy, then we'll begin the onboarding
Beautiful. I put in the chat, there is a link to Vu Tran's calendar. He would love to get in touch with you about this process. So you can book a call, click on that link, and I'll take you to his calendar. Okay, so any other thoughts before we wrap up this portion and open it up for questions?
Yeah, I guess I'll just close by saying that co-care is a really unique offering. There's nobody offering something like this in Canada. We are really trying to take psychedelic assisted therapy from a research setting into real world practice. And we recognize that right now therapists don't have the infrastructure that they need to support this service line in their existing practice. And we really want to work with you in a way that is rooted in best practices, is collaborative and supportive, so you can offer these innovative treatments to your clients that need it the most. We're really proud of what we've built, and we're really excited to partner with mental health professionals across Canada to change the way that they're supporting their clients.
Great. Thank you so much. Okay, so we'd love to hear from you. These sometimes spark a lot of questions, and we'd love to see you. If you have we'd love to see your face, if you're open to that, or I'll otherwise take your questions in the chat. Amy, I know we've been chatting, so I'm so glad you're here to ask your questions. Go ahead.
So one of my questions, I guess, first of all, is I'm an RN. Do you feel like there's a good place for us in the co-care program? Like, do you feel like there's going to be jobs for us, or is it more of a nurse practitioner role?
I don't know, Jacques, if you want to take that, or
I was wondering if you wanted it or me. So
well,
we can,
yeah,
I can help, but
you bet.
let me start and then you can see to jump in. So absolutely, we have RNs in our clinic as part of the integrated care team, and so it's not necessarily through co-care per se that they are finding their way into that type of work. But they are definitely a core part of the interdisciplinary team, whether it's in our corporate clinics or in the member clinics as they continue to expand across the province. And then when an RN is becoming a part of that interdisciplinary or integrated care team, they too need to be trained in psychedelics, so have that background core education for what the clinical practice is or what the clinical pathway is, and then how we work in partnership with therapists who are delivering the care. Now, I'm not sure which province you're in, but if you are in Ontario, then in Ontario, there are some nurse therapists as well. It's sort of a unique designation that they have, or there's a competency for psychotherapy in nursing. So we're working through how that competency can be used also inside of the care delivery for RNs who have a college, which is someone that holds them accountable, a license to be aware of the parameters of the complexity that they can handle in the delivery of that competency, and then going from there. So I want to give you as direct an answer as I can, knowing that it's a little bit different across the country.
I would just add, oh, sorry, I would just add, nursing wise, we use nurses in all the clinics, LPNs, RPNs, like psychiatric nurses, licensed practical nurses, we call them here, and in the clinics themselves, administering medication and holding space. Jacques is speaking to more, the therapy piece is a little bit, trickier with what the college will allow and, what people are regulated to do. And I noticed that you earlier asked a question about nurse practitioners. So when it comes to the prescribing of treatment, nurse practitioners can prescribe the treatment. So.
So the other question about that is there's a new program that they're doing from Dalhousie that's a nurse prescriber. So I don't know if that's more if that would be applicable to something like psychedelic therapy.
It would be harder to say in Alberta with the regulations as they stand now that it would they would need to recognize that qualification, and every province is in different stages of those regulations, so it's hard to say. No crystal ball right now as to how that would fit, but yeah.
Typically that sort of falls onto my desk to figure out. And so what I typically do is start within the province where the designation exists or is created, have a sense of what the core education is for that, look at what the college's position is on it, and then try to be supportive of that role emerging as was intended in that province. The challenge always is across provinces because our colleges hold different positions on different backgrounds or training programs and what it actually allows as far as scope within each of those provinces. But I have those conversations too. And so I work with each of those colleges to determine their position or stance, and then we go from there. If it's not already designation or designated in the regulation, because sometimes if you start there, it's already been called out, and we work from there.
The only thing I would add to that is we want to be innovative. We want to support there's such great diversity in people that can support psychedelic assisted therapy in so many different prongs. And so, yeah, we welcome that, which is why Jacques has to hunt those things down and get those questions answered.
Thank you so much. Paige, I believe you're in California. Let's hear your question.
Yes, that's actually sort of the core of my question. So I am licensed as a licensed marriage and family therapist in California. It's the master's level degree. It is equivalent within other states. It's reciprocal with sort of some states with the LCSW, the licensed clinical social worker designation. But I guess I'm just mostly wondering, obviously this is a evolving landscape in terms of requirements and licensing and all that. I know I'm looking to flee to your lovely country from the fascist states of the United States at the moment. Forgive my politicizing anything, forgive me. So I'm looking to make this move, and I'm just, there are actually a number of other therapist friends who are, for various reasons of vulnerability, also considering doing that. So I guess what my question would be is, what is your understanding at this point of the portability of California licenses to, we're looking specifically at Alberta, at either Calgary or Edmonton. So I guess I would just, what would be the general, do you have any understanding of that? Has this come up yet? And then also would that presumably be in tier 1 or tier 2 in your sort of model?
I can help with that in that, even movement in our designations across provinces starts always with the college. So even though I'm a registered nurse here in Alberta, I can't practice in any of the other provinces without registering with their college. And with workforce shortages, of course, they've made that process a whole lot easier now than it used to, because it used to take months and forever. Doesn't anymore. And so that portability of workforce is something that all of the colleges are aiming to support. But what they do within that college for your designation is do an examination of the education that supported the designation or the competency. And then they work sort of with a sense of across programs that are accredited programs, what are the equivalencies? So it always starts with the college. And so in your case, if you're a psychologist or a social worker or et cetera, it's about looking up the appropriate college in the province that you want to be in, and then going through their application process for them to acknowledge your credential and then say where you fit. And you're coming to Alberta. So in Alberta, the way regulation took shape, it was in the sort of Alberta health regulation, it specified that only registered psychologists and registered social workers or clinical social workers could provide therapy in the psychedelic assisted therapy space. That doesn't mean in the sort of molecule only space or whatever, but in that particular designation, those are the credentials you had to have. And they recognized when we communicated with them that that left out a ton of well-trained, very experienced therapists who may also be trained in psychedelics. And so, having those conversations around how those therapists can also participate in the province is what generated tier one in our province. And so it really is in the first province where regulation and credentialing came about. How do you manage what was within the regulation, what was intended in the regulation, and then how do you support the professional workforce that wants to participate? So that's what I would say first. So your first step is that. Of course, immigration is a whole other thing that I don't know a whole lot about, so I can't tell you anything about that. But that's where I would start with regard to what your designation would be when you land in the province.
That's what so with the College of...
So here it's College of Alberta Psychologists. And then it's not going to come from the top of my head, the College of Social Workers, but it'll be easily, if you put Social Work College Alberta, it'll come up. You'll get it.
Alberta College of
And
Social
the other
Workers.
two important designations in our province, well, there's tons actually, but two important designations are the CCC designation, so Certified Canadian Counselor. They have an association that supports designation, and Registered Canadian. I had it in my notes, but it's the RCC, I think, is the designation. So a separate association. I'll just go back and find it, and then I'll put it into the chat so that you can know those two associations.
Thank you. I do have a trip scheduled there in May, so I'm hoping to Calgary and Edmonton. So
remember your email.
Oh, you saw it. Well, thank you. Yes. Thank you.
Okay, Andrea wants to know, what are specific requirements for the practice site if you wanted to consider delivering the medication on your own private location? She is in Ontario in a private practice, as well as an associate of a larger group practice. Who wants to take that question?
I think probably Jacques, if we're talking about kind of like it starting your own service arm for psychedelics in your existing practice is what I'm hearing.
Yeah, I don't know if Andrea is camera ready.
Hi, Andrea. I want to make sure I understand your question.
So I'm just curious, if at some point I wanted to integrate this, if I was in tier 2, I think, and I wanted to invite a medical practitioner like a nurse to come in, and whether I was doing the sorry, the wording escapes me, but there's the psychedelic experience and psycholytic, sorry.
Psycholytic.
So I'm just wondering, like, is there specific practice site requirements? Do you need medical equipment on site? Are you looking at an investment in some sort of infrastructure like that? Or is it like, no, you just need a space and we bring it to you? And I don't know how that would work.
I understand now what you're saying. So yes, you actually do need to create context that has the appropriate equipment and ability to respond to an adverse event. It's different than a community setting. It's like healthcare instead of just therapy in a community setting. And so programs have medical leadership, so that regulated professional that is a physician that has oversight of the medical portion of the program. And then the program takes shape, meeting what is expected in the regulation requirements, and then in the College of Physicians and Surgeons of Alberta accreditation requirements. It's significant. So when we work with clinic owners to set up this service line, we set it up over a 6-month timeline to work with the business owner as a decision maker and then members of their team as the doers to get all of the things done that support infrastructure appropriateness, and then staffing appropriateness, and then ultimately policy and procedure protocol appropriateness to meet those standards. We've done it now a number of times, so it's something that it's, I don't want to say easy, because if you knew what you don't know, you'd know it's not easy. But with the support, if people move through the process easily and are able to add the service line easily. But it does that. I hear in your question that sense of, could I just have a nurse come and give the med, but then and be there to keep the patient safe? That's not actually an accurate perception of what it means to meet regulation and accreditation standard. But it is something that we can have an additional conversation about, or that you can talk to Vu about, with, sort of revealing what it actually does mean and what that process looks like.
I assume for the psychedelic therapy that would be the case, but I wasn't sure with the psycholytic therapy, because it sounds like it's a much lower dose medication. I thought that the requirements might be different.
It's not based on the dosage. It's based on the biophysical complexity of the client, the impact it could have on their existing health conditions, and any potential for adverse event. And so we think that way always as nurses, but it's helping other people to adapt that mindset of what a medically safe environment is and a medically compromised client is, and how you need to be able to respond.
You can always come into our clinic as a co-care person and do the psycholytic. So, and then we have everything set up and ready to roll. And so
I think, Andrea, that's a really important part of the question. When Suman was saying, working through sort of the bureaucracy and the regulatory standards, how that can be challenging, it's also then about how much throughput do you have to have in that service line to support sort of the investment that you make in creating it within your space. And so knowing that some people aren't clinic owners, they're therapists who wouldn't have the say over the environment to do it. And even in some environments, if every clinic tried to add it, it would sort of saturate. So knowing that it's challenging, we actually would want to work in service agreements with those organizations to say, when you have clients that are appropriate for this, let us provide the medicine in a medically supervised environment. And you, who are appropriate for the therapy, continue your relationship in the therapy with the client, and in your existing practice.
Okay, so one question related to that. So I believe there's a clinic that just opened up in Ottawa, or it's about to open up, close to Ottawa. So as a member clinic, would I be able to refer my clients to a member clinic and still be involved in their care? Or do member clinics try to sort of is that only for their clients?
So to be really clear, a member clinic is the one that built the medically supervised space. A partner clinic is any clinic in the ecosystem around them that wants to have that opportunity to bring the clients through the space for medicine, but then continue the therapeutic relationship with them, and the delivery of the therapeutic care. And so I always try to depict this sort of model as a bit of a hub and spoke. So in every geography, there should be a hub clinic that is set up to the medical standard. But all of the clinics around them should be partners, because our goal is access. It isn't about everyone having to build the same thing in every clinic and sort of saturating the space. Instead, it's about the therapy clinics that already exist all have patients in their panels who need this type of support. And if they work with the hub clinic, they come through for the medicine when they need to and stay a part of your panel or your practice for the therapy. And so everybody wins.
Okay, thank you.
Thank you, Andrea, for your question. Someone wants to know, what is the current cost for clients who meet criteria for special access?
So for psilocybin and for MDMA?
Yes, that's what it sounds
Yes,
like.
yeah, it varies, and varies substantially. In some cases, it really depends on the client readiness, and I want to speak to sort of the complexity that a lot of clients are experiencing that qualify for treatment under the SAP. And so sometimes when people are deprescribing in preparation for the treatment, they need a lot more support, especially medically supervised deprescribing, and then maybe more support with regulation. A lot of clients tell us these pills are not working, they're not healing me, I want the treatment. And then they find out when they stop taking some of their medications, that they were helping with a little bit of regulation. And so there's sometimes how the client safely gets to treatment varies. But right now, depending on whether somebody's having one psilocybin treatment to three, that's usually ranging from like $3,000 to $8,000. MDMA is more on account of its longer treatments, and there are two therapists present, generally speaking, and depending on how much prep they're needing and support in there, it can vary a lot more. Sort of more in the, I guess, 6 to 11 range is where I would put it. So it's and then again is depends on how many treatments that they would be having. So
Thank you.
And I think I just wanted to say something too about the, why the clinic setting. Well, we like to pride ourselves in a non-clinic-y clinic. So we really like open ourselves up to what people are comfortable with and what they need, and all the different approaches and richness in spiritual beliefs and all that kind of stuff. So I want to just, kind of make that statement. And what we found is there's just a real tremendous range of people seeking this kind of service. And, typically, people that have had a diagnosis, been on medications and have struggled, are more complex. And we've found out very quickly how blessed we were to work in an integrated interdisciplinary team to be able to manage that. But we do realize there's great variation and diversity in the client needs and how much time you've been working with them and all of those sorts of things. So
Paige, I see your hand. I'm just going to make through my way a little bit through these chat questions. Logan, is M. Scott occupational therapist? He wants to know if if occupational therapists are tier 1 or tier 2.
Yeah, OTs.
Okay, thanks.
So I think that because you're ready means me. So
oh, yeah.
occupational therapists they have a college of their own. So we always start with that. Do they have a college? Are they trained in the competency of therapy? That would depend on the individual. So we'd have to work with them to see what sort of educational background that they have. Does their college then recognize psychotherapy as a competency in their designation? So I would work with the college to determine what that is. And then after that, it would be, are they trained in psychedelics, and what are their years of experience, and can they handle this complexity? So whether they would end up being in the wellness or tier 1 or depending on your province, all of that gets determined through the process. And I haven't actually done the process for an occupational therapist, so I can't say where it will land yet. But just so you know in your own mind what those areas of investigation are to determine it, that's the steps I would go through.
Thank you. I'm going to take a quick pause here and do something that we've never done. And as we speak about co-care and accessibility and how we'd love for all of you to have more access, and all of your clients and patients and participants, we'd like to offer our training, which is typically $6,000, as Suman said. We would like to offer it to one of you for 75% off. So that'll be $1,500. If you have not taken our training, please put your email in the chat. Someone in our team will be recording it. We'll do a draw tomorrow. So again, that's 75% off of our co-care bundle, and it would come to $1,500 Canadian, which in American money is like $3. And so, yeah, we'll let you all know tomorrow who won that. And yeah, we just really want you all to be part of this awesome team. So just pop it in the chat as we're speaking. I think we have time for maybe a couple more questions. And I missed Lisa earlier, so I'm just going to quickly read it. She did the intro course through us and is wanting to access a personal psychedelic experience. What does she need?
Well, coming soon, we will have the ketamine course that has an experiential learning component to that. So that would be something that I would stay tuned for. And we do not have experiential learning opportunities for psilocybin and MDMA. They're done a little bit differently. And so I hope that answers your question.
Paige.
Yeah, so this is somebody asked or mentioned it in the chat. I'm unfamiliar with your healthcare system, but I'm curious. I'm assuming that whatever wonderful healthcare coverage you had there is not currently set up to cover these costs, these kinds of costs, which somebody mentioned in the chat, Kim, I believe, puts this out of range for most people. Is there any sense of, as this gets more traction and more sort of viability legally, et cetera, that at any point that your health system would cover parts of these, consider this like TMS kind of treatment? Or is that not, like, my insurance here in California covered TMS for me, like $20,000 worth. But they would not cover this, but I would anyway. So I'm just curious in the Canadian system how that is, what you're anticipating there.
I'll just take a stab at that because keeping in mind that Canadian American healthcare systems and how they're funded or supported is completely different. So what we can say right now is that psychedelic assisted therapy is not a part of our public health system. There are psychedelic interventions that are a part of our public health system. They're typically molecule only. They have very limited range of access, and sometimes as far as the criteria in order to be considered a candidate for them, et cetera. But psychedelic assisted therapy is not in the public health system. Insurance-wise, it actually is different in that lots of people have health insurance. And pretty much across the board, clients have within their health insurance coverage for medicine and for therapy. And so what I say to every client, because I still do info calls because I love it. I love talking to clients about the program. And so what I always say to every client is, if you have health insurance, you need to ask your health insurance provider 3 questions. 1, how much support do you have in your therapy allotment or bucket? Some people that will be $500 a year. Some people that will be $5,000 a year. Second question, how much of that therapy or that funding is still available this year? You don't want to be working with a false notion of how much you have to work with if you've already used some of it for this year. And then third question is, what type of therapist does it cover? Sometimes it will only cover psychologists, sometimes psychologists and social workers, sometimes counselors, but you need to know specifically so that we can pair you in the program with the right type of therapist that you have coverage for. And then as they work through the program, they can then start to determine what part will be covered by their existing health insurance, because they know that information, and what part would be out of pocket for them. And lots of times for clients, they have a really healthy allotment for therapy. And then, so when we do their sort of program, we help them to see what part of their program actually is therapy and what the sort of billing rates are for that therapy, so they know that the potential for them to get that back, how that would work. And then in particular in Alberta, if people have Alberta Blue Cross, so it's an insurer that's here, they've done a program enhancement that allows them to also, as part of their therapy bucket, have coverage for assessment, administration, and monitoring. So the role the nurse plays, so they can get even more of that treatment covered. A lot of therapists don't know that, and so can't sort of share that with their clients, but it is particularly important here in Alberta, where clients can get more of their care covered through their insurance.
And I think that
It's a
answers
really good question. I'm glad you asked it.
Great question. There's just one more question about veterans and coverage, and maybe we can also talk about WCV since things are emerging. Can either Lisa or Jacques talk about that?
She's quiet, so she's looking at me. Okay.
It's
Okay.
complicated. Anyway, go ahead.
It's a unique scenario. So unfortunately, we haven't reached a point with either of those organizations where it's crystal clear that they support psychedelic assisted therapy, and anyone who appears to us who comes from that scenario, here's the instruction on what you need to do. We're not that far along yet. What we do know, though, is that most people who are in Veterans Affairs have a caseworker that they work with. And so just like when people are coming through the care and need to work with their insurance company to see what their scenario is, we can give them that sense of this is what the program looks like. This is who provides what care inside of the program. This is after your prescriber visit, what the prescriber has deemed appropriate care for you, and then sharing this information with them, sharing this information with their caseworker, because their caseworker doesn't talk to us. Then sort of enables or empowers them to advocate for themselves to see what they can get covered. It's the same in a sort of a WCB scenario. When a client presents that way, we provide as much information to them as they can to work with whoever their representative is, and then see how that goes for them. Now, I say that to say that's as far as we are right now. We never stop advocating. And so continuing wherever a scenario, if ever a caseworker calls me, I take full advantage. Right? Finding out what they can share with me about what I need to do and how I need to empower those clients to gain access to support for their care.
I just wanted to add, because we did have somebody put in the chat, and it is true, there are hospital programs where a psychiatrist with an anesthesiologist present can order IV therapy, and it is charged to the healthcare system in that province. And then, of course, therapy comes at a different place. We don't direct bill, so so anybody that comes to us would be paying for their treatment and then being reimbursed for the therapy portion, but they would not reimburse in a community setting for psychedelic or psycholytic therapy at this time. Again, we said we're innovative, we're never stopping trying. There are groups, though, doing partnerships with first responders and Veterans Affairs, and then getting parts of it covered, but it depends on their setup. If they have a psychiatrist and an anesthesiologist who can order the treatment and bill it to the government, most of those treatments, in fact, I've seen none accompany therapy. They will give them the IV treatment and there is no therapy accompanying it with it. So when you say, can you cover psychedelic assisted therapy in this setting? They don't. So it's got to be pieced out into different services. So
Great.
It is
Okay, well,
challenging.
yeah. And to be continued, I guess, as things evolve and we're continuing to innovate and to advocate and to expand. We hope that you will all stay in touch, and we hope to see you in one of our clinics sometime soon. I think some contact information has been put in the chat, so please get in touch with us. We love connecting and getting to know what you're up to and how we can continue to work together. So with that, thank you, Jacques. Thank you, Suman. Thank you, Lisa. This has been great. Appreciate all of you. And if you're free and able, we'd love to have you at our next webinar on May 14th. We're going deeply into the difference between psychedelic and psycholytic ketamine, and we'd love to tell you all about that and answer your questions. So thanks again for being here, and we'll see you again.
bye.